Welcome to Run With It, BC's only running fitness and health show. On this month's episode, I was in conversation with two elite BC high school runners, so stay tuned for that. But first, let's go to our segment on cancer and exercise. Check this out. Joining me is Dr. Sharon Gurm. She is the clinic founder and medical director of Port Moody Health Integrative Medicine and Cancer Care. Also joining me is international recording artist. She's an author, humanitarian, and breast cancer survivor, Biff Naked. Welcome to the show. Welcome back, ladies.
Thank you.
So we talked about exercise and cancer care, and now we're talking about part 2 today. Mm-hmm. So are there any new developments with can exercise or running can treat or prevent cancer?
So, Christine, there was a recent study on exercise and breast cancer that was published just in September, in fact, and it led to some really interesting discovery. I certainly found it very interesting, and it caught my attention. So previously, we've understood that there's a strong body of evidence that exercise helps prevent breast cancer. It helps prevent breast cancer recurrence, and it also improves survivorship. And so that's led to some cancer exercise specific guidelines for women who have been diagnosed with breast cancer. Mm-hmm. And that consists of, generally speaking, 150 minutes of moderate intensity exercise every week. And still clinically, I certainly find in my practice, not every woman with breast cancer is able to commit to that, or, understanding why that's important. Even if we say, it reduces breast cancer risk, it'll reduce your risk of recurrence, it'll improve survivorship. The type of exercise that they're committing to, or even doing exercise, that behavior modification simply is not translating. And so what's really interesting about this recent study, is that they sought to understand better what are the mechanisms that are actually taking place when a woman is exercising, and the effect that would have on the breast cancer, the tumor environment, the breast cancer cells, because we don't fully understand those mechanisms yet. So there's a bit of a knowledge gap, and what was really interesting is these investigators identified that there are specific hormones that are released when you exercise. These are stress hormones, but they're stress hormones that are released during that acute period of exercise. And these stress hormones, specifically what they identified are norepinephrine and epinephrine.
Interesting.
Yeah, and that these hormones, when they're released in that acute, moderate to high intensity sort of burst of exercise, so transient elevation of these hormones, that then leads to some downstream effects in that tumor microenvironment. So they found it actually reduced the cell viability of various breast cancer cell lines, and it reduced tumor growth. And those hormones in particular, what they're doing from a physiologic, biologic standpoint, is they're actually influencing a tumor suppressor gene, a very critical tumor suppressor gene, that then influences the growth of tumors, the growth of the cancer cells, and even drug resistance. Drug resistance. So this is a huge finding. It's a huge discovery. And so clinically, how that translates, in my opinion, is this is now information that we can take to patients as providers, and the viewers and listeners who are dealing with breast cancer as a diagnosis. You can now better understand why that moderate to high intensity exercise, why committing to that for 150 minutes per week is so important. So, you can be gardening, you can be walking, and that's good exercise. It's good to be physically active and not be sedentary. But specifically, if you want to derive the breast cancer protective effects of exercise, you've got to be doing that moderate to high intensity exercise.
So would you suggest then, because this is really intriguing to me also, but for me and the survivors or patients that I've ever volunteered with in exercise, for example, a lot of patients who are diagnosed with breast cancer didn't previously exercise. And so it's new to them to begin with, but also they feel quite vulnerable and psychologically are not perhaps either capable or willing to envision themselves being able to start a running program, for example. So like you working with beginner runners, if they can walk at a brisk enough pace or at an incline, in your neighborhood, on a hill, whatever it is, or even swimming, is so hard. I'm like a dog drowning if I swim. But I can run or lift weights forever. But swimming is really cardiovascularly very hard.
Challenging, yeah.
So, I mean, what kind of exercises do you think it would require for a patient to get the benefit of those types of stressor hormones released into the system?
Yeah, so it's a great question, and I agree with you. I think that, we have to acknowledge that every person starts at a different level. Some have been exercising, at the time of diagnosis, they were healthy, following a good exercise regimen. But for others, it might be very new, or even the previous, exercise enthusiast that gets diagnosed with breast cancer and suddenly, is feeling a little ill from treatments or what have you. They may find then that it's challenging to carry forward with the type of exercise program that they were following beforehand. So it's important that we tailor an exercise program individually. We personalize it to what they can do. And this can just be a combination of, it should be, especially based on that study, it should be a combination of some warm-ups, some stretching, some resistance training, and then something that taxes the cardiovascular system, but not overtaxes it. And we've got to, build up that tolerance. And so cardio training and even resistance training doesn't have to involve using weights.
Right.
You can do resistance training using Pilates. You don't have to use any weights at all. You can just use your body weight. And again, you start at a beginner level and work your way up. Now, when it comes to cardiovascular training, not everybody is a runner. Not everybody is a swimmer. I'm a runner. I can't swim, so I'm not going to swim. But, if you've got to find out what you like and what you enjoy, and then work with that and build your exercise tolerance. So it could be dancing. It could be it could be swimming, it could be running, or it could be walking on an incline. And that can be enough to get the heart rate up and build that moderate to high intensity level where you're breaking a sweat, you're getting the heart rate up, you're taxing the cardiovascular system, and it's that short burst that's really important, so it doesn't have to be for extended periods.
Dr. Gurm, does exercise influence the estrogen levels in the blood?
So that's a great question. I think, and this obviously really pertains to women with breast cancer, the estrogen levels, right? There's a lot of discussion around estrogen and the impact that has. If a woman has hormone-sensitive cancer, obviously that estrogen is something that needs to be looked at. In women who have, say, a higher body fat composition, especially this is the case for, say, postmenopausal women, where's that estrogen coming from? That estrogen isn't coming from the ovaries necessarily in a postmenopausal woman or a woman who's had a hysterectomy. The estrogen actually is coming from the fatty tissue in the body. So through a process called aromatization. So this is where testosterone gets converted to estrogen in the blood in the fatty tissue by an enzyme called aromatase. So we call that aromatization of testosterone to estrogen. And then that estrogen then circulates in the bloodstream and can influence that hormone-sensitive breast cancer.
Wow.
So when you exercise, what happens? Your body composition is likely to change.
That's
right. You're going to have less percentage of body fat than you would if you didn't exercise, and hopefully, that's coupled with a healthy diet, and that way you can truly achieve the body composition targets that you want. But if you can lower that body fat composition, get it into an optimal range, then you're lowering the overall estrogen in the body. There are, of course, other ways to lower the estrogen too. So think about, dietary sources of estrogens, particularly with animal foods. Those are the big ones. Right? Animal foods generally contain more hormone, estrogen, and other types of hormones too that can be converted to estrogen. And so look at minimizing, or in some cases eliminating altogether, some of those animal food products like the meats and the eggs, the dairy, or at least, if not eliminating them, scaling back and being more mindful of how much you might be consuming.
Bev, any tips that you can share with our viewers who are struggling with what you've gone through?
I think that everyone has the same issue or excuse, and that is time. We don't have enough time. We're overscheduled. Many breast cancer patients are also mothers or working or trying to get back to work. We have busy lifestyles, and it's really hard not only to find an extra 20 minutes for anybody, to find a way to make yourself worth it. It's a worthiness issue more than anything else. And making an appointment with yourself is really your own commitment to your health. It's hard to do that, certainly with small children. I used to do it when, if I was with my niece or my goddaughters when they're sleeping, or take your dog for a walk. A lot of people have Fitbits. Those are great because they just really do count your steps, and walking is always better than sitting. I know a woman who's 81 who walks for 20 minutes in her apartment, and she walks and she gets her fists going, and she loves it. And that's what she does. She puts her headphones on and she does that. I know someone who has done step-ups on a coffee table, just in front of the TV while their baby is there in the playpen. Do whatever it takes, but do it for yourself. Things that you can do that are free are things at home: yoga, walking, walk around the block, anything. Walk up and down your stairs. Go to a park with your kids, and if there's a bench there, do step-ups on the bench while your kids are playing in the sandbox. Unless they eat sand, then don't. Make sure you watch them every minute. But then, except for me, that I've always done, being too busy, is always walking. We used to power walk when we woke up in the morning, no matter what. And because we couldn't run. If you are post-treatment, maybe you have osteoporosis, you really want to be doing weights and build up any type of resistance training to help your bone density. And it really does help. And again, that's something you do. Don't have weights, pick up a soup can. If your husband's like, mine eats a lot of soup, it's heavy, the cans are heavy. Do curls, do anything while you're doing TV, watching TV. I mean, you can do so many different things. Just try and do it as a commitment to yourself.
Well said, ladies. Thank you both for coming on the show and talking about cancer care and exercise part 2.
Great.
And we'll be right back after this break. Congratulations on your 3rd place finish at the BC School Cross Country Championships.
Thank you. Yeah, I had a really good race there and super happy with coming 3rd.
So you were did you expect that?
Well, yeah, I've had some good training and was feeling pretty good on race day, and the weather was a little bit cold, but yeah, it was nice to come top 3.
Yes, and tell us about your training for cross country.
I'm training with my club right now, Hershey Harriers. We do like 4 or 5 runs a week, and then a little bit of strength stuff, and then kind of like flexibility and stuff like that. But yeah, no, it's really fun. There's a great group of kids in the group, and it's a lot of fun.
So you're going to be going to the National Cross Country Championships.
Yes.
Congratulations.
Thank you. Yeah, it's in Kingston, so going there in a couple of weeks.
That's wonderful. And tell us now about you were in Italy, right?
Yes.
And how did that go for you when you were doing?
Yeah, so I qualified for the mountain running worlds in Italy as a junior. It was a really good experience going to Italy, which is super cool. Traveling for such a big race, and I don't know, it's just really cool just being there with like other countries and meeting some of the other athletes from Canada. I didn't have the best race, but I had a really good experience in Italy. Yeah.
What motivates you?
I think there's lots of things that make me enjoy running so much. So it's kind of hard to pinpoint a couple of things, but I just think there's a good running community on the North Shore, and I don't know, I just really enjoy running.
Yeah. So what is next for you after high school? Because you're in grade 12.
Yes. Yeah. So I'm graduating this year. Don't really know my university plans yet, so I kind of have to figure that out. But hopefully running on a university team.
You will, and you know you will, and you're actually, you know, you are from West Van, right? And
Yes.
tell us a little bit about the track. You don't train on this track right now.
Yeah, it's unfortunate that we can't really train on the track right now because it's like the first couple lanes, and it's just in a really bad condition right now. So we have to go to North Van to run at Mahan Park, and that's not even a 400-meter track. Sorry. But yeah, so when I'm running in West Van, I'm usually just doing my long runs, and then going to North Van for other workouts. But I think it'd be really good for more for the younger kids to have a track in West Van, so it's more accessible and kind of just promote the sport in our community, because we have such a good track community right now that I think can get even bigger.
Mm-hmm. And you're making it work, and
Yeah.
that's inspiring. And any tips for those who want to follow in your footsteps?
I don't know, just really enjoy training and kind of push yourself as hard as you can, and I don't know, have fun.
And you're positive, and anything you love running so much that nothing is going to stop you.
Yeah, well, I want to run for the rest of my life because it's such a good sport. But
Good.
I don't know, hopefully just stay healthy, don't get injured. I don't know, I just really enjoy it because when you train so hard, you do so many like hard workouts and stuff like that, you know, you focus on like every part of your life, like your eating and stuff like that. So it just gives you a lot of focus in what you're doing.
Right.
Yeah,
And
it's exciting.
what is your favorite distance?
For track, I don't really know, but like this year I'll probably focus on like the 3,000.
Mm-hmm.
So like a middle distance event. I think that's kind of my area of expertise.
That's
Yeah.
good. Well, I wish you all the best.
Okay.
Thank you.
Thank you.
Congratulations on your 15th place in the BC High School Cross Country Championships.
Thank you so much.
So, did you expect to do that well?
It wasn't a perfect race for me. I just didn't feel that good on race day, but I was happy overall with my season because I'd done really well at the club championship, so I was happy with that.
And it was better weather too.
Yeah, it was, and I was able to qualify for Team BC, and that was a huge goal of mine, so I was really happy.
Yes, and you're going to be going to the National Cross Country Championships in 2
Yeah.
weeks. Congratulations.
Thank you so much. I'm super excited.
Oh, so how do you train? Tell us about that.
So we usually train on the North Shore and then go out to Stanley Park for Saturday workouts. So we'll do like a couple sessions on the track and like grass fields, just try to keep the surface soft, and then do some loops in Stanley Park. So we kind of keep it varied.
Varied. So
Yeah.
it's good injury prevention.
Yeah, soft surface and not always the same. So
Yeah, that's wonderful.
Yeah.
Your specialty is 800 meters?
yeah, 800. Yeah, I really love it.
Why?
I don't know. I like the speed. I like that you can get it done fast, and it's kind of strategic. And yeah, I really enjoy it. I have a lot of fun on the track.
Great, that's great. And then
Yeah.
cross country is great too.
Mm-hmm.
How do you enjoy doing from track to cross country?
I definitely enjoy the shorter races, so I like the 4K compared to like the 5 kind of, and the faster courses to make a difference. But yeah, I really like it. I like the vary in the fall. So
That's wonderful. And what are your plans after high school? You're in grade 12.
yeah, so I'll be graduating this year. I'd really like to run on a university team, and I'm just kind of checking out different options, like meeting with coaches and seeing what would be a best fit for me next year.
What would be your dream?
My dream for post-secondary, or
Yes.
I'm not sure, just to really find a school that I can excel at and do the best I can over the 4 or 5 years of eligibility and see where I can go.
So what drives you to compete at a high level?
I'm really competitive, so that kind of motivates me, and I really just want to do well for my teammates and my coaches and all the people that have kind of helped me get to where I am today. So yeah, I want to do well for them.
That's right. And now you train not in West Van because the track is not up to par. And it's too bad.
Yeah, it is too bad. If we were able to train here, it's a nice central location. It'd be a great facility. We have to head to North Van and train at Handsworth, which isn't much better, or Mahan track, which we we have to run in lane 3 because it's not a full 400 meters. But if this track would be awesome for all the school teams to train safely without the risk of injury, and just the elementary schools to be able to have meets here too, and even for the high schools to be able to have meets on like a world-class track would be awesome.
Well, it'll happen.
Yeah, I hope so.
So I know I already asked, so you're in grade 12, what's next for you, but for leading up to the National Cross Country Championships in 2 weeks in Kingston, you're following your, getting enough sleep, nutrition, and training as well, but also tapering.
Yeah, for sure. Right now we're doing a few hard workouts before we'll start tapering in, I guess, like a week and a bit. But yeah, I just really try to make sure I'm going to bed early and getting the sleep and nutrition and everything that I need. So I'm really focused right now.
That's awesome. And congratulations.
Thank you so much.
Thanks for watching. If you have a question or comment about today's show, go to our website on the screen. For past episodes, go to our YouTube channel. Until next time, run with it. Run With It is sponsored by Be Well TV, Central City Brewery, Hype Hair, Mallory's Fashion Network and In for Women Clothing, Port Moody Health, Skechers Performance Canada, and Vancouver Sun Run presented by Ford.